Well, and for more on all that, let's go ahead and bring in Dr. Anant Bhan. He is a global health researcher at Melaka Manipal Medical College there in southern India. Dr. Bhan, thanks so much for joining us. Given the amount of cases, do you think that India responded to all of this too late?
Thank you for having me, Roee. So, India initiated one of the earliest and most stringent lockdowns in the world in March. But the infection spread has been going on even despite the lockdown. And what we are seeing now is, as the lockdown has been lifted in phases and we have an unlock period, simultaneously the spread of infection is happening from both urban areas to rural areas, and also spreading across the country. So the number of cases has kept on increasing at a time when more and more people are going out post the lockdown, and that certainly is contributing to the increase that we are seeing.
India, I understand, is considering granting emergency authorization to fast-track a vaccine. What can you tell us about that?
Yeah, so there's been a lot of talk, as has happened in many other countries, about potentially introducing a vaccine quickly. There are a lot of Indian vaccines in the fray, as there are other vaccines globally, and there are clinical trials happening right now in India. And the government has announced that they intend to introduce the vaccine in a quick way as soon as they have confidence that this is something which has some efficacy data behind it. But we will have to wait and see till we actually have some kind of data which allows us to use those vaccines.
There's been some discussion over the accuracy of India's death tolls, the numbers being called into question being quite low despite the high numbers of infections. Your thoughts?
Yeah, so there have been questions raised around potential underreporting of COVID-19 deaths, and there's been some scientific analysis trying to look into that. It's also true that surprisingly in some parts of the world, including in India, the death rates have been lower, and whether that's a function of immunity or the fact that the population is relatively younger as compared to many other parts of the world is something which requires more research.
Well, despite the growing numbers, some measures have been eased. Do you agree with that move?
Well, I think what has happened is that the economy has taken a hit over the last few months of lockdown, and I think there's now a realization that there is a need to also revive that. But unfortunately, what's also happening is that as people are going out, they might not be always following public health measures. For example, usage of masks or using masks correctly, physical distancing, hand hygiene, etc. And that certainly is causing a spread of infection, and that is a huge cause for worry. Because as you rightly pointed out initially, the infection numbers and the case numbers are certainly rising.
How effective and practical has self-quarantining been, especially given the crowding in many cities in India and the particularly small apartments that some of India's poor populations live in?
Yeah, that's been a challenge, I think, for many urban areas, especially urban slums and areas where there is high density of population. Quarantine within households or within communities has been a challenge. Responding to that, in many parts, local municipal governments or city governments have decided to ask individuals who live in these communities to shift to government-run quarantine centers. But part of the challenge also is that a lot of these infections end up being asymptomatic or those with mild symptoms. And these are the individuals who continue to stay on in these communities and probably are spreading infection.
All right, Dr. Anant Bhan from Melaka Manipal Medical College. Thanks so much for joining us.
Thank you for having me.